pretty sure before I became more involved with community conversations, I went to a conversation. I don't remember the topic, but I do remember really feeling empowered seeing Black women as doctors, providers, and also seeing other women in the community speak so openly about different health issues. The format is in the salon, 3 providers talk about different topics, and women are, it's a conversational situation, so women can come and ask questions freely, talk to the providers as if they are our sisters, our friends, and it gets rowdy, it gets fun, we cry, we laugh and everything, and so it's very powerful for me.
If there's a community conversation on mental health issues, those are ones that I really like to go to just to get more information, because I find different ways to cope with stress, because everything that we deal with and everything that they talk about, there's always some stress, anxiety, or depression, whatever it may be that comes with health issues. It's like you got a health issue and then all of a sudden you think about it and now you've got some anxiety or depression. So they always go hand in hand, you know, no matter what you're going through.
To be able to see that there are providers who look like us, who are not only treating and supporting women in their practice, but also doing research on these specific issues, health issues. To me, that it feels a bit comforting to know that, you know, we're not just kind of out here suffering from these things and nothing is being done. To me, I like to see that there is research being done that focuses on Black women, done by Black women.
I mean, one of the biggest things that we find is, or we do, is we always try to respond to the needs of the community we work in. And studies shown over and over again, the most stressed group in the country are immigrants. You know, one of the big things that CHNA17 did was we were doing a lot of little things. And CHNA17 really kind of made us think through, like, what are the goals of what we're trying to do when we do run a relaxation class? Is it something just so that we can say, well, we try to reduce stress in our program, or is there a larger impact that we could have? So, so that was one of the big things that CHNA17 had on us. It made us started to really think and evaluate, can we have a larger impact within the community? So we developed a mental health ambassadorship program where we had a social worker, or a graduate school social worker, come in and talk about mental health and work with a group of students or constituents to build their capacity to figure out what to do. So there are a couple things, especially working in the immigrant community, you deal with a lot of stigmas of, mental health being a bad thing. You're talking about, seeing a therapist, medication, there's all these other stigmas that are out there, and we needed to figure out ways, how can we divert that to get people the needs, and then also let them understand that there are resources out there.
About 5 years ago, the police department at that time had a couple of incidents where there was responses to individuals with mental health, and there was an unfortunate incident where there was a fatality. And so the chief at the time had reached out to the health department where I was working and said, hey, we really feel like the officers need some mental health training. Another thing, about 2 years ago, there was another opportunity through the CHNA looking at policy and looking at creating policy to support folks getting access and resources for mental illness. And so through that grant, we used our experience with mental health first aid. We created a 2-hour training for all frontline city employees.
I thought it was rather a bold move of CHNA17 to say, we're going to focus on how do we kind of like bring this to broader communities, and really choosing to fund additional people to go get trained, so it wasn't just Patty. It was like, what are the barriers we can remove from our local communities to allow this to happen?
CHNA17 means mental health for all.
To me, CHNA17 will mean that we can continue, or they can continue to pay it forward. That's what it means to me.
I think when I think of CHNA, it really does mean community. I know that's the first C is community, but it really is around kind of opportunities to share information around, kind of how are we really supporting people's health in a community way.
CHNA is a community of learning.
CHNA17 is hope. CHNA17 to me is mostly that it's a group of people who really want to make an impact and change.